Have you ever had repetitive, persistent, and intrusive negative thoughts regarding a lived experience or an emotion? Have you ever noticed how everyone reacts differently to these negative thoughts, and how some are minimally affected by it? Well, these negative thoughts are part of a cognitive process called rumination. Hey everyone, my name is Rumination, and I'll be discussing my investigation of rumination patterns through a source imaging approach. Rumination is when an individual actively engages in negative thoughts and focuses on the causes and consequences of their negative mood, resulting in a cycle of depressive thoughts. Rumination has been shown to amplify the effects of one's negative mood on their cognition, resulting in cognitive fixation. This prevents individuals from critically thinking and engaging in active problem solving. They are clouded with their rumination. Now, not everyone has the same level of rumination. In fact, there are numerous cognitive factors that can influence the severity and length of their negative mood, including their response to rumination. But this begs the question, are there any differences in the activation patterns or visible physiological differences between low and high ruminators? And if we think more on a holistic level, what part of your brain is actually involved in these ruminative pathways? Well, this is what I sought out to determine by using source imaging, specifically beamforming. Beamforming is a neuroimaging technique that allows us to identify the cortical structures involved in rumination. It works by analyzing the electrical activity within the brain collected through an electroencephalogram, EEG, and uses source localization algorithms to identify the most active brain areas throughout a given task. EEGs have great temporal resolution, but lack spatial resolution compared to an imaging modality, so such source localization algorithms are required. If you look at the brain model on the left, that is essentially a source model with points within the brain in red, overlain with a volume grid. Using source localization and this model, we can estimate where the signals obtained from our scalp EEG electrodes originate from. Specifically, we can analyze the signals throughout our volume matrix and use density approximations to determine the strength of the signal and correlate it with the physiology of the brain. This allows us to truly investigate the activation patterns throughout one's ruminative process. Although the results have not been analyzed as of yet, we believe that the findings will show that ruminations are associated with increased activity in areas involved with the default mode network, such as the cingulate cortex, and decreased activity in the prefrontal cortex, as seen from my slide. Areas in red represent high activity, whereas areas in blue represent low activity. Additionally, we believe that you will notice that in the high ruminator's brain model, the activation within the mentioned regions are amplified when compared to the low ruminator's brain model. This is possibly because the high ruminator has consistently focused on their distress, reinforcing that pathway in the brain, leading to increased activation and a more severe rumination cycle. Overall, rumination is a normal thought, but excessive rumination can lead to mental health issues. Therefore, it's important to understand its neural basis. Thank you for listening to my presentation.